BCS class 2 and BCS class 4 drugs are insoluble, while BCS class 2 drugs are highly permeable and BCS class 4 drugs are low permeable. So if you consider these two classes, the solubility is low. That's why the solubilization techniques are required to be used to enhance the solubility, dissolution, and bioavailability for these drugs. I welcome all the viewers to this video. This video will be informative for the BCS class 2 and 4 drugs for improving the solubility, dissolution, and bioavailability. Enhancing the bioavailability of these insoluble drugs is a very important thing, and it is a critical thing. It is a challenging thing in the formulation R&D because these drugs are poorly soluble. So before solubilization, the drug cannot get permeated. Improving the solubility can enhance the dissolution, and dissolution can improve the permeation. But if the drug is showing low permeability, that time the other techniques along with the solubility improvements are required to be used. So for BCS class 2 drugs, solubility improvement is required, while for BCS class 4 drugs, improving the solubility plus permeability is required. BCS class 2 drugs are low soluble and high permeable. So the rate limited by solubility and dissolution thing is there. Absorption or permeation is not a critical because high permeability is there, but the solubility is low. Once you improve the solubility, you can get high permeability. So dissolution is a thing which we should work on. Strategies to enhance the solubility and dissolution. First of all, it is a particle size reduction for the API. You can micronize the API or nanosize the API by different technologies like wet milling, high pressure homogenization, so that you can get the reduced particle size, and reducing particle size will increase the surface area and ultimately it will improve the dissolution rate and the solubility will be increased. That's why you can improve the bioavailability. Then is the solid dispersion. Solid dispersions can be made with polymers. You can use polymers like povidone, HPMC, HPMC phthalate, HPMC acetate succinate. So many polymers are there, and different technologies can be used like hot melt extrusion, HME, and spray drying with the polymers. So these polymers can convert the crystalline drug into amorphous phase, and amorphous phase will have improved solubility. Then lipid based formulations. So self-emulsifying drug delivery systems can be prepared which can enhance the solubilization in the GI tract. You can use dextrin complexes called as cyclodextrin complexes which can form inclusion complexes to improve the aqueous solubility. Salt formation techniques can be used to improve the solubility, useful for the ionizable drugs to improve the dissolution rate. You can also use surfactants, wetting agents to decrease the interfacial tension and improve the solubility. So surfactants enhance the wetting and reduces the interfacial tension. Sometimes dual or triple type of combination can be used, like using the surfactants, also making the lipid based formulations, or using the surfactants along with the solid dispersion technology. Then coming to the BCS class 4 drugs. So BCS class 4 drugs are low soluble and low permeable. So we should work on the two fronts because the rate is limited by both solubility and the permeability. So the most critical drug class is BCS class 4 drugs. Dual approach strategy can be used for solubility enhancement, same as the BCS class 2, like solid dispersion, micronization, use of salt form, changing the crystal form, and many others. And also here permeability is required to be increased because BCS class 4 drugs are low permeable as well. Permeation enhancers are there. Some excipients increase the permeation. So use of excipients like bile salts, fatty acids, surfactants like twin 80 or polysorbate 80, sodium lauryl sulfate, or SLS you can say, to enhance the GI permeation. Prodrug approach is there, modifying the drug molecule to improve the permeability, then metabolize into the active form post absorption. So this is the way how the prodrugs work. Carrier systems can be used like lipid nanoparticles, liposomes, micelles, polymeric nanoparticles, which can improve the solubility and the transport across the membranes. That's why you can improve the permeability as well. Bioadhesive systems can be utilized to improve the GI residence time. Bioadhesion can be done, and by these techniques, the absorption window can be improved. Then formulation technologies can be used like amorphous solid dispersions, lipid-based systems, nano emulsions can be made, nano milling can be done, wet bead milling can be done, micronization can be done, ion pair formation or permeability enhancement can be done for the BCS class 4 drugs. Key considerations here are like ensure the physical and chemical stability of the enhanced formulation because we are making some changes. Evaluate impact of excipients on the permeability, and it is more likely for the BCS class 4 drugs because BCS class 4 drugs are low permeable. Perform the in vitro and in vivo correlation wherever you can do it and wherever it seems to be possible. These are some of the ways to enhance the solubility, dissolution, bioavailability. Whenever you are asked a question that how to improve the bioavailability of BCS class 2 and 4 drugs, you should answer like we need to work on the API, we need to work onto the composition of the formulation, and we can work on the design of the formulation. So by these technologies, we can improve the bioavailability of the poorly soluble drugs belonging to BCS class 2 and 4. Thank you for watching the video.